When I first started working with people with intellectual disabilities as formerly being a GP in Victoria and also having worked in psychiatry for a while, it was really apparent from that experience, but also the experience of the literature, that people with intellectual disabilities often have health problems which are easily undetected and sometimes when detected not treated at all adequately. The reasons for this are complex, including problems with communication and recall, and obviously attitudinal problems. And what the health assessment process does is it gives a credible entry into primary care. It gathers a good story, a clear outline story that can be readily accessible to the GP, and then it says to the GP or the practice nurse, these are the problems that commonly go missed or are not dealt with well. And it also says that to the staff and the families and the person with a disability, that these are the problems that you really need to have a close look at. And then it tries to encourage people to communicate with each other about future planning in terms of healthcare. It also provides information about syndrome-specific things. It says to the GPs, and the practice nurse, these are things that you might need to think about that are in your world, that other people in this person's life may have no understanding of, and you need to address them. So it provides an opportunity to do that all at once, to focus on the broad range of things, the long-term health care, rather than just the short-term immediate need. Why is this so important? Well, what we found in all of the studies, and in Queensland we've been very fortunate to be supported by Endeavour Foundation and many other groups to do the highest quality studies that have been done in the world, the biggest and highest quality studies called randomised controlled trials. What we found is that we just didn't make one or two differences, but pretty much across the board we changed healthcare delivery in terms of immunisation, pap smears, attending to weight problems, picking up medical. The process has now led to a change in health policy with myself and many other people advocated for this change, and eventually a health assessment item was set up for people with intellectual disabilities and is now available for everybody with an intellectual disability, and is time-based, so the GP and the practice can be reimbursed for their time. We also now, the tool that we developed called the Comprehensive Health Assessment Program, or CHAP tool, is licensed by most state governments in Australia and most of the larger non-government organisations, and it is available for use. From time to time I get messages from people, and the most recent one was somebody who works in the disability sector just thanking me and my group for having produced a tool that picked up somebody's prostate cancer and has led to successful treatment. Previously somebody approached me after a talk saying they'd picked up lymphoma in somebody and is now being successfully treated. These are very real circumstances for people, and it's been a massive delight to be able to be part of something that's now globalised and used throughout Australia. So while it might seem like an administrative chore, and while it might seem something really difficult for you to be involved in, there is really good reasons for your clients that you care for that people should be having a health assessment almost certainly every year.